Hey, welcome to the Explainer. Today, we're going to break down the official treatment protocols for COVID-19.
So, with all the noise out there, how do doctors actually decide on a treatment plan for a patient?
Thankfully, there's a clear roadmap. Official guidelines give doctors a structured path to follow.
And here's the thing, it's not one size fits all. Treatment depends entirely on how severe the disease is.
So the illness gets broken down into 4 stages. It's all based on vitals, like breathing and oxygen levels.
Let's start with the mild cases. Most people fall into this group, and they can manage it at home.
Here, the focus is simple: symptom relief, hydration, and just keeping a close eye on your vitals.
Okay, so there's a key tool for this at-home monitoring. It's called the 6-minute walk test.
It's a really simple way to see if your oxygen levels drop with a bit of exertion. That's a red flag.
And if you get a positive test, that's a clear sign it's time to head to the hospital.
This is the dividing line right here: home care versus the hospital. So let's see what's next.
For these moderate cases, once you're in the hospital, the main goal is just getting you enough oxygen.
This means giving oxygen, steroids for inflammation, and also anticoagulants, to prevent blood clots.
But things get serious when oxygen drops below 90%. That means an immediate trip to the ICU. Here, treatment gets ramped up. We're talking ventilators, plus those steroids and blood thinners we mentioned.
So what about those drugs you've heard about in the news? Like remdesivir?
Well, remdesivir is an experimental drug. It's not for mild cases and is only used in the hospital.
And look at how specific the criteria are. It's for hospitalized patients on oxygen and only early on.
It's a similar story for tocilizumab. This one's used only when steroids aren't enough for severe cases.
Okay, but just as important as what to do is what not to do. The guidelines are super clear.
First, big warning: steroids are a no-go for mild cases. They can actually be harmful. And this is why self-medicating is so dangerous. Steroids absolutely require a doctor's supervision. No exceptions.
Another thing to avoid? Chest CT scans for diagnosis. The radiation risks just aren't worth it.
So, you see, COVID-19 treatment is a step-by-step journey, guided entirely by how severe things get.
Knowing this roadmap helps you ask the right questions, and that's key. That's it for this Explainer.